We are continuing our Women's Care Wednesday segment today, and this morning we are joining you from a very special place. I'm excited to tell you about this because we are at Women's Care Florida, their Women's Health Center, and joining me this morning is Ellen Bauer, the Regional VP of Operations for Women's Care Florida. And again, I know this team is very, very proud of this facility because it is something truly unique, I believe, in the Tampa Bay area. So Ellen, explain what this is and why this is so special, this building being right here in the middle of Tampa.
Sure. So our Women's Health Center is really a specialty center for all of our subspecialty providers. So Women's Care Florida has a lot of OB-GYN providers who most of our patients are familiar with, but we also offer a plethora of other specialties. And so here located, we have our gastroenterologist, plastic surgery, endocrinology, maternal fetal medicine, breast surgery, and a number of other specialty services that we offer here, all centrally located for ease of access for patients.
And talk about why that is important to kind of have a one-stop shop where all your specialists are here. We were talking before the segment got started, and I think so many times when you do have to go see a specialist, obviously there's something going on, right? And what is it about having a one-stop shop to kind of get everything done?
I think for a lot of people, especially if you need to see a specialist, there's this increased anxiety that happens with that, and really want to ease that as much as we can as an organization. It's easy in and out. You can park right at the front door, and there's also this element of coordination of care that we can really help for the patient. So they're not having to call each other from all over the Tampa Bay region. They're all here together. They can walk to each other's office and collaborate with the care for the patient, which is amazing.
Yeah, that really is. I think, we hear about how important communication is between doctors and specialists. You have nutritionists here as well. I mean, give us an example of kind of the communication that does go on.
Sure. So if you have a patient who is an OB patient who has gestational diabetes, which can be extremely stressful for a pregnant mother, here in this center, we are able to coordinate with our maternal fetal medicine, which is a high-risk pregnancy doctor. You can come and see a nutritionist here. She can make you a formalized nutrition plan to stay on task throughout your pregnancy, and an endocrinologist who is really a diabetic specialist and is able to maintain your medication throughout your pregnancy as well. And so we're able to offer all of that care very collaboratively here in the center, which is amazing for our patients.
Well, and talk about this facility too, and it doesn't look like a hospital when you drive up, but some of the offices and some of the specialties that you have here, if you have to have a procedure done, an out-of-office procedure, it's just as safe as a hospital.
Correct.
Talk about that.
Correct. Yes. So we have a lot of ancillary services here that we can provide for patients. So we have an ambulatory surgery center. Patients can come here and have their outpatient surgery done as opposed to going to a larger hospital facility. Here in our clinic, it's safe, it is great cost of care control, and the ease of access for a patient is wonderful. We have infusion services. Patients come here, not only can they have their chemotherapy here if they are seeing one of our oncologists, they can also have benign infusions. So if we have a dehydrated pregnant patient, they can come here for just hydration therapy instead of having to go into the overwhelming nature of a large medical facility where there's lots of illness and germs and sickness. They can kind of come into a home-like environment at our state-of-the-art facility.
Well, as we get ready to kind of wrap it up here, I feel like when people or families are looking for doctors, looking where to go, I feel like this is kind of the future of where healthcare maybe at least should be.
Sure, absolutely. I think one of the things we're seeing healthcare move to is this patient home and a centered home where they can see all of their doctors are connected together, and Women's Care is really moving in that direction to better support our patients and make sure that continuity of care is always there for them.
Well, that's why we're so happy to be partnered with you guys, and again, having these special segments every Wednesday where we can kind of let people know what's out there, what is available. Thank you so much for your time today. We're going to make sure and put all that info on our website as well so it's easy for you to find.